Hi, my name is Dr. Nathan Yang. I'm a dentist here at Northeast Medical Services. I'm also the dental director here. I'd like to talk about something that's really important to me, and that is how do we treat anxious patients? In our line of work here, in terms of doing dentistry, we want to treat everyone equally. But sometimes we have patients that are not only afraid and anxious, but also to the point of being scared and not being able to come into the dental office. Let me give you a story. We have a lot of patients here that come in pain. We have a lot of patients that come in with questions about how they're going to be treated. Is it going to hurt? And we assure everyone that yes, the treatment that we're going to give you is going to help you out, and we're going to do it in a way that is going to be calming, and it's going to be in a way that's going to keep you happy and have you come back. But sometimes patients are in so much fear that it prevents them from coming to the dental clinic. And we want to educate patients and give them reassurances that when they come here to NEMS or any dental clinic, here in our NEMS offices, that we will find a way to keep them happy, but also reassure them that we're going to treat them well, and also bring their fear levels to a level that they'll feel like, hey, when I come to the dental office, it's not so bad as I thought it was going to be. We have different ways to help. Some may require medication. Sometimes it'll require a type of gas that will help you bring your anxiety levels down. But we also have non-medicinal ways of trying to bring your fear and anxiety levels down. Sometimes it might be with music. Sometimes it might be with a video. Sometimes it may just try to make you laugh. Or sometimes we'll try to use a blanket. And what we have here is a blanket that we can put over a patient while we're working on them. And the idea is that there's these acupressure points that will bring their blood pressure levels down, that will bring their anxiety down, and hopefully bring their blood pressure and just keep them in a way where they're not going to feel anxious and worry about every little movement that us dentists do. So we have this here at NEMS, and I like to show how this works. So we have our patient, Lily, and the scenario we like to use for our patients is if they come in and they let us know, hey, I'm nervous, I'm anxious today, what's going on? And usually before I say anything, I try to explain what's going on with the appointment. I give the patient all the information they need, and then I ask them, hey, you know, if you're feeling anxious, you feel like your chest is tight, would you like to try on this blanket? And a lot of times, hopefully this blanket will make you feel like you got a warm hug, that we're sitting you back, and we just want you to hopefully stay relaxed. Would you like to try it out? All right, so let's give it a go. So what I usually do is put this on top of the patient just like this. Okay?
Yes.
And then we're gonna sit them back. And then you can put your head down here. And then we do this. And then before we do anything for the patient, we ask them, would you like the chair more up? Would you like it more down? And then we ask the patient, how are you feeling?
Really nice.
Feel a little more calmer?
Yes, more calm.
Good. And so when we get the patient feeling a bit more calm, it's a lot easier for the dentist to sit down, work with our patients, and instead of the focus being on what is the dentist going to do next, I'm really nervous still. Hopefully the feeling is more about, hey, Dr. So-and-so, I want to tell you more about this problem that I have. And all of a sudden, instead of the dental visit being focused on the anxiety, the dental focus now becomes how can we take care of our patients' oral needs. We have this great option of having this blanket for our patients. So hopefully, with more patients having the different options to be less anxious, less nervous, and get their care done, the better we can help everyone in our community and help them really feel that oral care should be routine, not when it hurts so much. Thank you.